Hi, I'm Tonya Burrow. I am a diabetes specialist pharmacist and I'm the founder of Diabetes Consults. Today, I wanted to talk to us about our feet. Yes, diabetic feet. It's just something that we don't really talk about or we don't really pay attention to. Maybe the women do when they go and have the pedicure, but that's really concentrating on the nails, not the feet. You may go to one of the shops where they scrape your feet, or you go to one of the shops where they scrub your feet. Whereas that's good. If you're diabetic, I really will be very careful about that. Now, there are certain questions that really one must ask, like themselves, like, do you or notice, not just ask yourself, you would notice if you get certain things, like do you get a burning sensation in your feet, do you get tingling of your feet, do you get like a pain in the feet or dull ache, do you get like a swollen fit, or sometimes some people say they lose some hair, which is out of the normal for them. Now if you do, and you haven't seen a specialist, I would really make an appointment to see someone about that, because one, you could be losing some sensations, which is what we refer to as neuropathy, which is really like your nerve endings are beginning to become affected because of the diabetes. Now, we're asking, what should you do? You can do a couple of things. If you're in the UK, obviously or in a country where they check your feet, obviously make an appointment to get someone to do that. Now, if you're in a place where there's no one who does that for you, you can get your family members to just check your feet. Close your eyes, get them to use a pen, not a pin, a pen, like the back of a pen, just to touch certain parts of you under your feet, just to see if you can get the sensation. Now, in terms of checking pulses, that's quite difficult. So you do really need someone who knows what they're doing to be able to do that. But again, I would ask, do you wear tight shoes? Like especially women, sorry, women, but we tend to try and see like a really good pair of shoes and go, I really want that, and you just put your legs into this shoe, and you might feel it's uncomfortable when you go you were wearing. That can start to like cause corns and calluses around the area, and that is not good if you are diabetic. So I really would look at the shoes that we wear. Comfort, like they say, no pain is gain, but in diabetes you really need to choose comfortable shoes that don't cause all these problems around the area. Now, another thing that you need to do is look at your feet daily. Like we wear shoes, you may wear flip flops or slippers, or anything that you don't necessarily have to look at your feet. But I would make it a point of duty, like just have a daily look, either first thing in the morning if you're not rushing around, or in the evening. Take a look at your feet. Like, are you noticing you're getting wounds or sores, on there? Pay attention to those. Get someone to look at it. Don't say, oh, it's a sore, it would heal. I don't want you to be frantic about it, but obviously being diabetic, your wounds will take a lot longer to heal, especially if your diabetes is not under control. So once you get a wound in your feet, or somewhere around like the bottom of the feet or the top of the feet or wherever on the legs, get someone to please look at it. Because trying to look at it avoids things like amputation. Yes, I have mentioned the dreaded amputation that people do not like, but unfortunately they are happening. And sometimes when we see cases in clinics, there are things that could have been avoided. Maybe somebody paid a little bit more attention, to their feet, or came, like a lot sooner than they did. We would have been able to refer them to the foot specialists, who are called podiatrists. But then in the community, if you are trying to if you're diabetic and you want to, like get the hard skin off the bottom of your feet, please don't go to anyone. Look for a chiropodist, someone who's specially trained to look after the feet, take off hard skin and all of that. And when you get there, tell them that you're diabetic so that they can pay extra attention to you, because trying to cut your nails, sometimes you can clip yourself, and these things in some people can lead to ulcers, which can actually cause a problem. So let's look after our feet. Let's reduce the rates of amputation. Let's ensure that our diabetic controls are under, like diabetic controls are good, glycemic controls are good. If you're not sure what to do, seek a specialist. I'm available to talk to you if you want to talk to me. So please, you can use the link in my bio, like get a free 15-minute consultation with me, and I'll be happy to have a discussion with you. But please, from me to you, wherever you are in the world, whether it's morning, afternoon, or evening, look after your feet and have a great day. Bye.